Good afternoon, everyone. Nice to see you all here, token Englishmen. My name is Mark Lever. I'm the Chief Executive of the NAS. I have been for the extremely long period of about 5 weeks. I didn't know anything about autism before I started. During the recruitment process for the job, I got thoroughly hooked onto the issue of autism. The great sense of unfairness that I think exists for people who are autistic and for people who support people with autism, and the tremendous sense of challenge that you all face. And I just felt that if I can do a little bit to try and help that and make that a little bit easier, then I've done something worthwhile, and I really do feel that. I've never felt like this about a job before. I've worked in the charity sector for about 15 years, but certainly this particular role has created a sense of motivation in me which I've never experienced before. So I'm really looking forward to leading this wonderful organisation over the next few years and really trying to make a difference. I've been really impressed by the quality of this campaign. I can claim no credit for it. It's been running for the last few months, but really impressed with the quality of the campaign, the quality of the materials, and the impact that it seems to be having at all of the events where it's been launched. And I think the trick for us is to try and build on that and really try and make a difference with the campaign. Events like this are great, but it's got to be translated into action. Just thought I'd share with you some of my initial thoughts and observations about the NAS over the last 5 or 6 weeks. I've spent a lot of my time travelling around England, Scotland and Wales, visiting our projects, meeting staff, talking to people about what we do and how we do it. And the sort of lasting impression that I have is of an organisation which is started with really remarkable people who are so committed and so focused to what the NAS is trying to achieve. It's incredibly impressive. I think, when you see the support workers, some of our schools and some of our projects, I mean, these are incredibly resilient people who are incredibly dedicated to the individuals that they're there to support. And I remember visiting one particular registered care home where the people they were supporting had very high levels of dependence, and just seeing the environment they were working in and seeing the focus they had. And I said, how do you do this job every day? And they said, we are just totally focused on the people that we're here to support. We don't have to be distracted by anything else that's going on around us. We're just totally focused on trying to help this person get the best out of their life, get the best they can out of their life. And it really does touch you when you see that and see the people who work in that way. It's incredibly impressive. And I think what the campaign does is build on the collective expertise and collective understanding of autism and bring it to the fore. And make some fairly simple requests, really. And I think this is what's struck me, is that parents, people in this room, people who are supporting people with autism, you're not actually asking for very much. What's being asked for isn't really that much, but it makes such a massive difference. I've been hearing about the befriending schemes that we run and the respite schemes that we run, and these are fairly short periods of support but make such a massive difference to families and to the people with autism. And we're scratching around trying to find funding where we've got a waiting list of volunteers wanting to be trained as befrienders and carers. We've got a waiting list. I heard that we've got 250 families on the waiting list waiting for this service to be provided. We've got an excellent training programme. We've got a superb team of people waiting to train these volunteers, and all we need is a bit of cash to provide the service. And you think, for £1,000 a year, we could train a volunteer and get a volunteer to go and deliver 2 or 3 hours a week befriending respite care to a family every week for a year. That's 20 quid for that level of support. And when you think about the difference that would make to that family, I really do struggle with the equation that we cannot find the money to do that. And I don't know who the decision makers are in this room, but I'm assuming you're in there somewhere. But to think about the way that a small amount of funding can actually provide that level of support and can actually put off problems in later life. I mean, there's plenty of evidence in this report that suggests that, you know, in our survey, over a third of adults with autism suffer, said on the screen, severe mental health difficulties. Now, the cost of supporting people with severe mental health difficulties makes actually the funding that we're looking for fade into comparison. And I think that, you know, we need to encourage people to take a longer-term view of the impact that some of this short-term or this relatively low-level, low-cost support can have in the longer term. And I appreciate that, you know, when people look at elections and look at budgets, you know, the focus is perhaps a year ahead, a month ahead in some cases if you've got elections next month, you know, a year ahead, 2 years ahead. But if you just step back and take a slightly longer-term view, you know, the math is simple, and the support should be forthcoming to try and provide this, you know, this level of support and service.